where I come from, the health system is disjointed. You come to a country like Australia, where there is a process of going through the health system. You go to your GP, you go to Allied Health, you go to emergency. They're all different things. So learning about this helps me to work with my community as well, work with our clients who are relying on us to provide them with information, but also to give them some guidance on how to navigate the health system in Australia.
My people who come from India are not having that type of medical facilities there, and I was also not very much aware about what all is there inside the health services.
There's a lot of refugees that need support around accessing health, because there's a lot of barriers when accessing health.
Walk Through Health is an immersive experience. It's a learning opportunity, and it's one that a number of people took up from different multicultural communities representing the diversity of Wyndham, coming together to understand more about what health and health access or healthcare access looks like in Wyndham. People have got different experiences from a range of different countries and contexts, and this helped them understand how to access, what to access. It also helped the providers hear from those who are accessing their services on some questions that they may not realise. So it was a two-way educative experience. We have this program so that we can share learnings and find out ways to improve access, remove blockages, address assumptions, and also to give people opportunity to understand some of the different ways that health is both the resources are addressed, how they work together, how people are referred, what are the different practices and processes that they may not be familiar with. And it's also to make people feel safe and give them confidence so that they can access services when they need it, not just when there is when there's an emergency.
Well, in this country, one senior member or a person, migrant people coming from the different country, it is very, very useful or very compulsory for them to know about the systems here, because most of the time they don't get help from their children to go out to see somebody or tell about their health problem and all this. So if they know what is happening and what all facilities are available, they'll become more independent, and that is good for them.
It operates by people coming together and being able to engage with the different health providers. So we have a structured approach, and we look at a range of aspects, which includes visiting a GP, visiting a hospital, hearing from specialist providers, be that around diabetes or cancer or alcohol and drug challenges. So it takes people through a progression of services, but also understanding the way in which the services work to address issues. And it gives opportunity for people to ask and have their questions responded to.
Werribee Mercy Hospital is situated in the city of Wyndham, and we know that it is one of the most culturally diverse parts of Australia. At Werribee Mercy, our patients come from more than 200 countries of birth. They speak more than 170 languages, and they follow more than 80 different religions and faiths. So it is a world in a small locality. In terms of our services, we do everything from maternity and babies all the way along that continuum to, the palliative care and kind of end-of-life issues. So multicultural services at Mercy Health are responsible for ensuring that our organisation develops strategies to ensure we provide culturally appropriate care. Part of that is providing interpreting services to our patients, but also thinking about a range of other strategic ways in which we can do that. Training our staff on delivering culturally sensitive care is another significant component of our work as well. But something we all love to do is the community engagement, and which was part of this Walk Through Health project.
When I heard about the Walk Through the Health, I thought this will be a great opportunity for me and my people who come from a country where these type of facilities are not available.
In the Walk Through Health program, we try to improve health literacy of our participants in order for them to be able to take that information to their own communities and to share it with them, and hopefully through that process, improve the health literacy of the broader communities. We know that health literacy impacts everyone anyway in the society, but we know that migrants and refugees are more likely to have low health literacy when it comes to Australian system in particular.
I myself need to understand more of information before I pass down information to the communities when it comes to accessing health, yes.
Being a migrant myself, where I come from, there is no way to complain about a health service. There is, nobody talks about healthcare rights necessarily. So we find that that was a significant thing in our program to highlight to the participants that there is an Australian Charter of Healthcare Rights, and sometimes people are not aware of it. So we made sure our participants knew that and understood what rights they have when accessing health services. We also talked about the system of providing feedback, compliments, complaints and suggestions, because again we know culturally that is not something that people would think of or think it is appropriate. So unpacking that there is no retribution if you actually give a health service negative feedback, but in actual fact we would use that to improve our services and to make sure that it doesn't happen again to another person, and really having fascinating conversations with our participants around those challenges and the level of comfort and discomfort in terms of providing that feedback. For us at Mercy Health, we are fortunate to have a small but a lovely team of people that can assist non-English speaking consumers in particular through that process by providing them with interpreters, scheduling times, translating their complaints if needed, and those kinds of things, which is a small step in trying to assist them to feel more comfortable to share their experiences.
The other thing I was interested in was the consumer rights, in a way that in Australia we are able to provide feedback in a way of improving the health system, but also you're able to provide feedback to complain about how you were not treated well or what your expectations were not met. That was a little bit amazing to see that it's possible, because where we come from, you take what you are given, because who complains about the doctor? You can't, because you're fearful of person who is well educated more than you, person who knows best. So I think that was really interesting to see that we can provide feedback about the service, but also we can complain about not receiving the service.
I work at Werribee Emergency Department. We see a variety of people from all different cultural backgrounds and ethnicities from all different age groups. When they present to our emergency department, it could be something simple, or they might need overnight care. People who come to our emergency departments come from a variety of different multicultural backgrounds. We aim to meet their needs and provide them the best care we can. We do this by giving them access to our on-site interpreter service. If they come through after hours, there is also an after-hours interpreter service available for them to use as well. It's really important for everyone to understand the process of triage. Triage is a vital process that everyone who presents through the emergency department will go through. When patients present, they will get triaged with the categories ranging from 1 to 5. 1 meaning that they need to be seen most urgently by one of our medical doctors, and 5 meaning that they can wait to be seen. Some people might not understand, whilst waiting in the waiting room, that people will get bored ahead of them. This means that they will need to be seen by a medical doctor more urgently than them. This makes sure that everyone remains safe and we see the patients that need urgent care more quickly. Recently, we have introduced the red flag system. This is a card that lets parents flag areas of concern. If they believe that something is not quite right with their child and they want to escalate their care, they can initiate the red card, and a staff member will be able to come over and reassess their child. Our red card system is available in multiple languages for our multicultural community. It's really important for our emergency department to be involved in the community education programs. Everyone in our community needs to know how to access our service so we can provide care for everyone.
I think in my head, hearing about the emergency departments, you rock up and you're taken care of immediately. But I think the experience has been that people spend hours and hours at the emergency department, which is kind of a frustrating thing for people thinking about emergency, that you choose not to go to the GP because you don't know to line up or to wait. When you go to the emergency, it's completely opposite. As long as you consider the GP for half an hour, you can be seen. So it gave me an understanding how the emergency department happens, but also it helps you as an individual to assess your situation. Is this something I should be going to the emergency department and spend maybe 2 hours or 3 hours waiting to be seen, or should I go and make an appointment to see my GP? So that was, for me, was very interesting to see.
So the Health Independence Program is a program that supports people who may have just left hospital. It's based in the community, so I suppose it's more of an outpatients type program. It has 5 different services attached to the program, and one of the key ones would be community-based rehabilitation. So that's supporting people who may have just come out of hospital and are quite weak, or who have perhaps a progressive issue going on where they need some support. They might need physiotherapy or occupational therapy to regain some of their strength, or they might come in and say, I used to be able to garden, or I used to be able to play with my grandchildren, and I can't do that anymore because of changes to my health. So we have a real rehab focus. We also support people who have chronic diseases, so we call that complex care, and that's really supporting people who are struggling to manage changes in their health, or who perhaps even have a number of different issues, could be with their heart or with their lungs, and they need some education, or they're finding it really difficult to navigate their way through the health system, which is a challenge a lot of people face. So our job is to help coordinate that, work with them, and ensure that they're getting the right supports. Another really important program that we offer is a continence clinic. And I say that's really important because I think continence issues are a little bit taboo or stigmatised for many people. There's often quite a lot of shame attached to it. So what we find is that we're getting a lot of referrals for people, men and women, who are struggling with urine incontinence or bowel incontinence, or who come to us for a different problem, and then as they get to know us and we assess them, they then disclose that they're really struggling with toileting. So we have a fabulous continence nurse and a physio as well. We have a falls and balance clinic too, and we often see a lot of older people who are struggling with changes to their balance, or who might have fallen and broken their hip and are quite fearful, and that makes them more at risk of falling. Sometimes we see people with changes to their memory or other cognitive changes that also means that they're more at risk of falling. So we have fantastic physio and OT who work in that program. And finally, we have a residential in-reach program, and that's one of our nurses who goes into nursing homes and supports people in those nursing homes who might be at risk of coming into hospital, and he works with the workers and the nurses there to ensure that they have good nursing support. One of the challenges or issues that we see that men can face is mental health issues, and I think that that's a reflection of adjusting to changes to their health, losses that they incur because their health is changing, and they perhaps can no longer go back to work. They aren't as independent as they used to be, and I think that that's a massive impact. So on perhaps men start becoming more socially isolated, or they didn't have that social network to begin with. They feel like they can't ask for help, or they're not used to asking for help. There's perhaps some shame around losing of independence. And So yeah, we see men who can present as quite depressed, quite socially isolated. So and sometimes it takes them a while to talk to us about that because it's quite personal. But one of the wonderful things about working in the Health Independence Program is that we can take some time to get to know people. So we build trust, we build rapport with our clients. And what I find is that over time, men can start to open up and will start to say, yes, I don't enjoy things that I used to do. I sit at home and I feel lonely and I feel sad for a lot of the time, and I don't care about anything anymore. I guess that's one example of what we find. So we really support people to try and link into the right mental health support. Could be contacting their family doctor, seeking their permission to just let the doctor know, and trying to open up that discussion and letting them know that this is all very understandable, because facing changes to your physical health can often have a major impact on your mental health.
I saw that people who spend quite a long time in the hospital after their surgery or recovery and all this, so they get some time to come back to the normal life, and it boosts their morale, because once a person in a hospital for some time, he see the same things every day and watch everything every day. But when he come out and do different type of thing like light exercise, talking to people, watching different programs and all this, so that when he comes out of the hospital, he's in a better mood and better come back to the life more easily.
Utopia Refugee Health is a primary care centre based in the far west of Melbourne, and we provide primary care to refugees and asylum seekers in the Wyndham LGA. We're trained specifically in providing for needs for the refugee community, and so the GPs and nurses here have training in bloodborne viruses, so we see lots of patients with viral hepatitis and HIV, and we also see patients with TB and post-traumatic stress disorder. So men of refugee background have additional barriers in seeking healthcare. There's the language difference and there's the difference in culture, which makes it difficult for them to seek advice. Some of the things that we've done at Utopia is by having bicultural workers present, male and female, having healthcare professionals, male and female as well, so men can choose to see a male if they prefer. And we also use interpreters for every consultation where the patient doesn't speak English. I think this goes a long way in overcoming some of the barriers. Women, even in the best of health, might still use the health service for things like family planning or care during a pregnancy. And so for women, the clinic is usually a place that they have been to, that they're familiar with, and it's easier for them to seek healthcare. Men, on the other hand, might not seek healthcare until they're a little bit older, maybe in their late 30s or 40s, and it might be a daunting place. They might be unfamiliar with the setting of the clinic and the healthcare workers. And I think it takes a bit more courage, if you like, for men to seek healthcare. But it's important that men seek healthcare because there are several conditions that men are more at risk of. For example, the rate of suicide in men is much higher, and so it's important that men who feel depression or low mood seek assistance in the early stages. The same with cardiovascular diseases, so men are more at risk of heart disease and stroke. And I would encourage all men aged above the age of 40 to see their GP for a heart health assessment.
So my experience in the gambling help area has helped me to understand the stigma that's associated with many of the health issues that men face. Gambling is just one of them. Gambling has an effect on people's physical health and on their mental health. And we have services for both sides of that equation, people's mental health and their physical health. The staff here understand the stigma associated with the health issues that men face. They are open, don't judge, and they are here to help. So we've mentioned some of the barriers that men might face when it comes to looking after their own health. And it's difficult to overcome some of these. We understand that it's difficult. Language is obviously a difficult thing to overcome, but we are able to provide help with interpreters. We even have health professionals here who speak, and customer service people who speak community languages, so they can speak with somebody and be confident that what they're saying is going to be understood. We have access to interpreters to come with languages that we aren't able to cover here, but we have an interpreter service that we use for that certain part as well. We also understand that, especially in smaller communities, people can be nervous about who the interpreter is going to be. So if we need to find an interpreter that is not local, we are able to do that, so that the confidentiality and the privacy of the person that we are helping is maintained, and they can be confident that the information that they give and that they get will be kept private. So another issue that men from other cultures face is that the word counselling doesn't exist in their language, and so the concept is a brand new one to them. What I would encourage people to understand is that if you are being counselled, that doesn't mean that you have a severe mental health issue. What counselling means is that you have a friend who can help you find the answers to your issue.
The most interesting thing for me is mental health and well-being, because a lot of time when we talk about mental health, the community doesn't want to open up. You know, a lot of time because it's almost like a stigma, you know, in a way. When we talk about mental health, a lot of time people thought, oh, I'm crazy, you know. When we talk about bringing this kind of issue, and then people doesn't want to talk about it, you know. And then until I attended the program and then I try to understand more, you know, how to, when you come across stress, you know, how to deal with your emotion, how to control them, yeah, through some of the technique, maybe breathing, you know, going out for a walk, you know, so these are some of the things that will help you through the stress, yeah.
Cancer Council Victoria has been here in Victoria for quite a long time, so since 1936. And we have been working on a lot of activities related to prevention, research, care and support for people who are affected with cancer. And cancer, as you know, that it has been, there is no one, nearly no one who has not been affected by cancer at a certain time. There are around 35,000 people who are usually affected by cancer every year, and here in Victoria, and 11,000 of them will die because of cancer. As a community engagement specialist, I work at the prevention unit, which we were trying to reach as much as possible, as many communities as possible, especially from the priority communities. And these priority communities are communities like from Aboriginal and Torres Strait Island backgrounds, people from multicultural and cultural and linguistically diverse backgrounds, people from or people with disabilities, as well as people from LGBTIQ communities. As a Cancer Council Victoria, or as a community engagement specialist, I participate in different community events where I try to provide information to different community members, either through participation of events that are organized by partner organizations and key organizations like Wyndham Community Education Center, as well as also organize a number of education, community information sessions or community education sessions on specific types of cancer like bowel cancer screening, cervical cancer screening, breast cancer screening, as well as hepatitis B and liver cancer screening, and trying to provide them with the needed information to minimize the risk of getting cancer. People from multicultural backgrounds or cultural backgrounds, they have the issue of feeling shy to speak about different types of cancer or look more vulnerable. So that's why it might be also a difficult issue to discuss issues related to different types of cancer. Also, there is the issue of language, which could be a language barrier where they can express their needs or the problems that they are facing. At the same time, also when they receive, like say, the bowel testing kit, which is in English, some people might not understand even the word cancer or what's written in the instructions, so they don't know exactly what to do with the resources and the things that has been already provided to them. And here comes also the importance of the program that you are providing at Wyndham Community Education Center, as providing English support as well as language support, and at the same time also relating it to health-related issues. Also the issue of thinking that it's a God's will. So if God's is we have been affected by cancer, then there is nothing that we can do. While especially in many types of cancer, if we detect cancer early, then we can easily get it treated, which is not in some of the beliefs that are existing. So there are different issues that are faced by people from multicultural backgrounds, especially men. How we are working on that is to provide as much as possible in language resources as well as in language information sessions. Also, in addition to that, also we are trying to reach them through social media, like many groups, especially I know that a lot of multicultural communities, they have their own like WhatsApp or Facebook pages that they can work through and they feel more comfortable with when you provided them information through those media outlets which are existing. One of the main types of cancer that we are working with in is bowel cancer screening, and trying to promote the National Bowel Cancer Screening Program bowel testing kit, which is usually sent to every Victorian who is aged between 50 to 74 years old every 2 years to their home address, which is registered at Centrelink. And every Victorian needs to do this test every 2 years. And it's a very simple way, at home, easy to do type of kit that will help them save their life and keep themselves healthy, as well as minimize the risk of getting cancer, especially if we know that 90% of, or more than 90% of the cases which have been discovered early on bowel cancer screening could be easily treated and lives could be saved.
The benefit to community is that people who are moving into Wyndham, who are living in Wyndham, from a range of cultures and backgrounds, they understand more about the services that are available in Wyndham. And also the services understand the demand from different people moving in. So some of the assumptions, some of the experiences that people have, those can be addressed. I think it strengthens both the understanding at the community level, because those that are being involved then share their experiences with others, talk about it within their communities, and give confidence to others to then feel that they can go and visit some of the services that perhaps may have been a mystery. So that's on the one hand. On the other hand, it also helps the services better prepare and review some of their approaches that may enable people to feel more comfortable and be able to be confident that they are going to receive a service that is relevant and necessary.
What do you think that you got out of this experience?
Well, as I told earlier, the most interesting part for me was that I got all this knowledge and since I understand the local language, I could convey or return back all those things to my people in their own language, so they can always take help of the facilities which are provided by the health department there.
Through learning with this program, I get to tell my community and I share with them. Even though a lot of time they want to close the conversation, but at least I was able to pass down the information or link to them, so they can reach out or they know what to do.
And it was really good to see men from the community come together and really take an interest and ask some excellent questions about their health. The conversation about health is always two ways, and rather than me talking to people, it's good to have a more open style conversation with the men.
A lot of multicultural communities and communities that we are working with from the priority communities that I've mentioned before, they do prefer that personal one-to-one touch. And whether we do it online or whether we do it face-to-face, but they always prefer to see someone who can speak to them rather than just watching a video or something like that, someone who can respond to their questions.
There's two things that I would like this project to achieve. The first is to get more men and more people in general to engage with their health service and seek preventative care advice early. And the second thing that I'd like this to achieve is for funding agencies to provide primary care services with the resources necessary to provide this care.
I've been empowered to be able to have more knowledge which I can use to impart to the communities I'm working with. But also been empowered as a family person so that I can share that information with my family members at home. I can speak to my kids about it, I can speak to my wife about it, who have not been able to attend the session. So the knowledge is going to be useful not only for me, but for my family and my community.